So we have a 60-year-old man has just undergone a bronchoscopy with some trans bronchial biopsies of the right lower lobe and is noted to be tachypnic and cyanotic right after the procedure was finished. Uh-oh, this can't be good. His O2 sat was noted to be 87%. His cyanosis does not, and the not is underlined, improve with supplemental oxygen. This can't be good. Bilateral breath sounds and chest rise are noted. Which of the following interventions is most likely to improve his condition? Oh boy. Is it A, administer or put him in a hyperbaric chamber, and B, administer methylene blue, C, get an arterial blood gas and a chest x-ray, D, intubate, why not, and E, place bilateral chest tubes. Now, this is a tricky one, so I'm going to give you folks a little time to think about this. So once again, a gentleman, 60 years of age, bronchoscopy with transbronchial biopsies of the right lower lobe is now tachypnic, cyanotic. What do you want to do? What do you want to do? Yeah, it's these moments where I can't wait to do live lectures again. It's going to be so fun. But I think one of the most important things when I do, board review is, kind of like process of elimination. I think that if you could cross out at least one of these, there's 5 choices. That improves your guessing by 20%. 2 is 40%. Which one would you folks cross out right off the bat? Yeah, I hear you. You folks are amazing. And what do I mean by that? Oh my God, you guys are so fast. I would say you could cross out C, ABG and chest x-ray. Why? Well, number one, what does the question say? It says, which of the following is most likely to what? What's this word? Improve. So bottom line point is you could ABG all you want. And image all you want, it won't make him feel better. So C is going to be wrong. What else is going to be wrong here? I think clinically, just throwing someone in a hyperbaric chamber, that sounds kind of mean. I wouldn't want to do that when his sats are dropping and he's tachypnic. So pretty much I wouldn't do A and C just, based on clinical gestalt and reading the question. What else seems kind of a weird choice? Yeah, I think someone said it. D, intubate. Now, why would intubate kind of be the wrong answer here? For a couple of reasons. Number one, there are many reasons to intubate, but I'll tell you one thing, if you were hypoxic before you intubated the patient, like our patients with COVID, you could intubate them all you want. They're still going to be what? Hypoxic. So intubating is going to protect the airway, don't get me wrong, but it wouldn't really treat the underlying cause of what's going on there. So though tempting, it's always great to be up on your procedural skills, but I would say that, A, C, and D are going to be wrong. So it really comes down to methylene blue or placing some chest tubes, and the right answer is, yeah, I guess I'm bullied into picking what? Methylene blue. And so the question is, why? Well, E, I only did biopsies of the right lower lobe. That would be kind of mean to put in bilateral chest tubes, especially if I'm getting bilateral breath sounds and chest rise. But if you didn't like that answer, what about, this part right here where the oxygen does not improve with oxygen? So when we talk about causes of hypoxia, most things like a VQ mismatch really respond to supplemental oxygen. So if you have a pneumothorax, should it respond to oxygen? The answer is yeah. In fact, for some cases of pneumothorax, we definitely give supplemental oxygen to help reabsorb, the air and everything. So I really don't think E is going to be the right answer. So if I'm kind of bullied into picking methylene blue, who could tell me what is the diagnosis? Anyone? And once again, I wish we were live. I could see you yelling the right answer. And methylene blue is going to be the antidote for what disorder? Yeah, methemoglobinemia. So when we talk about methemoglobinemia, number one is that, well, what is it and how does it relate to this question? So methemoglobinemia means that, our hemoglobin, has a porphyrin ring, and this ring has an iron moiety, and the moiety is in what oxidized state. If So we have the Fe+2, which is the ferrous. There's too many sounds here, isn't there? So our hemoglobin has a porphyrin ring that contains oxygen, which is Fe+2, which is the ferrous. And something like genetics or drugs can change it to Fe+3, which is the ferric. I want to make sure I say it correctly. So unfortunately, when you're in that ferric state, Fe+3, two things could happen. Number one is that you can't bind oxygen to the hemoglobin. And because of that, the O2 stat's going to be what? Low. And people with hemoglobinemia, they've really got a low O2 stat. And this patient's O2 stat was what? Like 87%. And on top of that, not only can you not bind oxygen there, the oxygen that's already on the hemoglobin can't be relinquished to starving tissue. So it shifts the O2 dissociation curve which way? All the way to the left, just like what? Carbon monoxide. So when we talk about how do we treat hemoglobinemia, well, the antidote is what? Methylene blue. How do we diagnose it? Well, you still need to get this ABG, and you need to go to a what? Co-oximeter, and you got to run it so they give you that hemoglobin level. Okay. And when we talk about a couple little things, number one is that if someone gets methylene blue and all of a sudden they start hemolyzing, it's not very common if they start hemolyzing on your pulmonary boards. What type of anemia do we worry about in people who start hemolyzing when you give methylene blue? You folks are so amazing. You worry about what? G6PD deficiency. You never know who has it. And of course, you get the peripheral smear. You look at these bite cells, and these bite cells are these Heinz bodies, All right. And then one more thing I'm going to ask you, because it's a classic board question, is what on earth, you know what I mean? Back to this question. By the way, how did this patient get hemoglobinemia? Who could tell me? He had a bronch. Why did he get hemoglobinemia? Drugs. And of course, what are going to be some classic drugs that cause hemoglobinemia? Well, you have to remember the nitrates on the board exam. Nitrates are a classic one. Antibiotics like dapsone can definitely do it. But why did this person get it? That's right. Those class 1A, 1B, 1C antiarrhythmics, things like what? Lidocaine. So before you do a bronch, what do we usually do? We numb up those cords. And I've done this before when I was a fellow. I mean, you just sometimes go to town with that lidocaine. And of course, if you give too much lidocaine, that can induce a hemoglobinemia. And that's what happened in this case. The answer is methylene blue. And what I'm going to ask you is, when on your board exams, may they want you to, induce a hemoglobinemia as kind of an antidote for a toxicity? That's a classic question on your board exam. So when do we actually want to induce the hemoglobinemia? And the answer is, you're right, cyanide toxicity. And yes, even on the pulmonary boards, the critical care boards, they're always going to give someone who either has hemoglobinemia, carbon monoxide, or cyanide toxicity. And of course, cyanide toxicity, think about someone who has that. What does their breath smell like? Yeah, like bitter almonds. I always wondered, why is it bitter almonds? Yeah, you're right. I think there's cyanide in almonds. That's right. It's also in peach pits and all those kind of things. And of course, how do you die from, having cyanide toxicity? Is cyanide loves to bind in the mitochondria. In the mitochondria, what do you have? The electron transport chain. It loves to bind to what they call complex 4, so you can't do oxidative phosphorylation, that's a bad thing. And why does it bind to complex 4? It's because complex 4 contains Fe+3, which is the what? The ferric. So in theory, if you induce a hemoglobinemia, well, RBCs that have hemoglobin, will turn to the ferric. And remember, in red blood cells, there's no mitochondria in red blood cells. There's no nucleus in red blood cells. So it goes all to the RBCs instead of going to the cells that have a mitochondria. So it's not going to inhibit electron transport. And that's why, what was the antidote in the olden days for, cyanide toxicity? It was always give you these nitrates, because what was one of the most common drugs that induces a hemoglobinemia were the nitrates. So somehow they always seem to ask this question on the boards.